Next is regarding the review of concept of health as well as illness. So when we are moving to this concept of health and illness, we have got certain theories. Now we will not be dealing regarding all of these theories in detail. We have got theories related to health, some theories are related to illness. So all this we are not dealing, only few of this will be dealt. So first of all, before dealing with all these theories, what do you mean by health? So we have got a definition that is given by the World Health Organization. Health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. So this definition you will be all might have already gone through in first year, and again you will be dealing regarding this definition in community as well. Okay, so it is good that you remember this definition of health. Now, when we come to health here, what are the signs of good health? A signs of good health means usually here the person should be having equilibrium or balance that promotes comfort in the patient. So when we tell about good health, a person should have physical health, mental health also, as well as social health. Now, physical health means it could be related to certain physical disabilities or certain diseases. Mental health, we are already aware, a person should be mentally sound. Then social health, they should be able to maintain a good relationship with the members in the society. So that is referred as social health. So only when an individual is having all these three, we can tell that a person is completely healthy. Okay, both, that is physical health, mental health, as well as social health. Next is, what are the factors which are affecting health? So we have got variety of factors which will affect health. So first of all is human biology. Okay, I'm not covering all the factors here. Certain factors only I'm covering. So what is human biology? Human biology in the sense a person is made up of genetic materials. Okay, genes, they are made up of their own genes or chromosomes, what we call as. So each person is unique, each person is different. So based on their biology, their health will be. Okay, so suppose if you have got any hereditary problems in your family, okay, so that in turn may affect your body or it may affect your health. It could be like some bleeding disorders are present, or individual may be carrying the similar genes of we call it as oncogenes, isn't it? So human biology mainly affects your health. Second one is environment. Now your environment, it includes your internal environment as well as your external environment. So internal environment is inside your body, okay, the what you are eating and all that. Now external environment mainly refers to the air, the water and the other factors. Now if there are lot of pollutants in the external environment, or you're exposed to lot of toxins or chemicals, that in turn can make you unhealthy. Okay, or you may in turn fall sick because of the environment. Okay, so this is also one of the major factor that is affecting the health in the present generation. For the present generation, what we tell is environment including your food is affecting a lot. Next one is your way of living. Now way of living, when we compare the past and the present, lot of changes are there. In the olden days, that all the work was done manually, and most of the time there were no machines to carry all the work. But presently, what is our lifestyle practice? We can just sit in our couch and we can literally, the machines can do the work for us. Okay, so all this lifestyle practices, it could be your sedentary lifestyle. Now sedentary lifestyle means physical inactivity, isn't it? Most of us nowadays just sit, we don't do any work manually at all. It could be like go walking for long hours in order to reach your destination, or preparing meals, or it could be like washing clothes and many other physical work. All the work has become less now for an individual, mainly because of this advancement in the technology and because of this machineries. So physical inactivity or sedentary lifestyle in turn can result in lot of diseases that we will see later when we are coming to each disease condition. Okay, so most of the diseases or illness are because of our lifestyle. Next is economic status. Now, economic status doesn't play a major role as such, but if we consider the poor people, that is poverty, these people tend to have deficiencies, okay, mainly because they are not able to eat good food. And on the other hand, when we come to the population which is having enough money, or which we call it as people of higher status or the rich people, they tend to get certain other diseases because of eating junk food or because of unhealthy practices or unhealthy eating practices. It could be like obesity or hypertension or any other disease conditions. But presently, we cannot distinguish this particular thing that deficiencies only the poor people are facing, because presently the unhealthy lifestyle is followed by the entire population. Okay, so that also can play a major role in affecting our health. Next one is availability of health services. Now, availability of health services in the sense, most of our population is in the rural region, so there could be a chance that this rural population is not getting access to the health care. So because of that, what happens is they may get certain diseases, or in turn they may not be able to manage with their disabilities. Next one is safe physical environment, that I have already dealt in environment. Next one is supportive economic and social conditions. So that also plays a major role. The society where you are living, the neighborhood where you are living, that also can affect your health. Next is diet. Now this I need not explain. Following or eating a good diet will help a lot. Along with that, if you are having all unhealthy practices like eating lot of refined flour, or maybe eating lot of sweets, or oil rich food or fat rich food or saturated fats, that all in turn can affect your health here. It can result in increased cholesterol levels, that is referred as hyperlipidemia. Next one is safe sexual activity. Now, safe sexual activity here refers to not having any sexually transmitted infections or STDs. We have got lot of sexually transmitted infections like HIV, gonorrhea, syphilis and all. So, it is always necessary to follow the safe sexual practice. Next one is positive self-esteem. So, always remember that having positivity in your life or having good self-esteem, that in turn can promote your mental health. Staying always you are angry, or full time you are getting irritated, this in turn can affect your health as well. Next one is feeling of trust. So always try to have a feeling of trust towards the other individual. That does not mean that you should follow everything blindly. It just is an human nature. Try to have little bit of trust in other individual. Next is safe and clean drinking water. Now, this also we are aware, if you are not getting access to good or clean water, that in turn can result in waterborne diseases, isn't it? So, always see that the water which is available, you are boiling and then cooling and drinking the water. Next is healthy public policy. Now, this also we have seen previously in trends. So, see that each individual or all the public is having certain health policies so that they will get access to the health. Next is positive mental health. When you have positive mental health, that in turn will help to improve your health. Next one is if you have good housing or if you have got a job, that in turn is like a security, and that in turn can help to maintain your health. Next one is concepts of health. So these are certain theories of health here. So the first concept is biomedical concept of health. Second one is ecological concept of health. Next one is psychological concept of health. And the last one is holistic concept of health. So these are the certain theories that is given by each individual. So that is their idea regarding the health. Okay. Don't think that each of this theory is correct. That is their theories. They have given those theories. Okay. So first one, moving on to biomedical concept of health. Now, what is biomedical concept of health? So first of all, biomedical concept of health is related to germ theory. Okay. Now, germ theory means, according to this theory, entry of pathogens is responsible for a disease. Okay. So here the theorist, the person who has proposed this theory, tells that disease is occurring mainly because of entry of pathogens or microorganisms. I don't think disease is only because of entry of pathogens or microbes. Many other factors are responsible for a disease, isn't it? It could be environment, lifestyle practice, or social conditions, or mental health, or even cultural determinants. We have got lot of determinants of health, not only pathogens, okay? But this biomedical concept is telling that disease is occurring only because of entry of pathogens, okay, or microorganisms. Second theory is, or second concept is, ecological concept of health. So according to ecological concept of health, it is actually regarding the study of environment. Study of environment is nothing but ecology. Okay, so here only it is there. Ecology means study of environment, and the person who is studying the environment is called as an ecologist. Okay, so ecologist is studying the environment, and according to this theory, it is telling that disease or illness is because of maladjustment in the environment. Okay, disease is mainly because of maladjustment in the environment. I don't think this theory is also right, isn't it? Because only maladjustment to environment will not result in ill health or sickness. There are many other factors which are responsible for diseases, isn't it? But this theory is telling that only problem in the environment is responsible for disease. Maybe that you are not getting clean water or clean air, or there is a ozone layer of the atmosphere is not there properly. That in turn may be resulting in ecological concept of health. Okay, so next one is moving on to psychological concept of health. Now psychological concept of health, this theory is telling that if you are having mental problems, okay, or psychological problems, behavioral problems, that is affecting your health. Okay, so it is telling that if you have mental problems, then only you will get disease. Okay, so this is also not right, isn't it? It is telling that only mental problems are there, you will get disease. That is not true. If any other problems are there also, you can get diseases, isn't it? So psychological concept of health states that a person's psychological or behavioral or their cultural factors, all that is affecting the health of an individual. Okay, it is not giving importance to any other things, only giving importance to psychology or the mental health. Okay, so this theory also may not be absolutely right here. Next one is regarding the holistic concept of health. Now, this is exactly the concept of health which is correct. Holistic concept of health means whole. Okay, holistic means holism. It means, it is taken from the Greek word holos, which means whole. Okay, so according to this theory, it is telling that the health of the individual depends on all the factors. It could be physical health, mental health, emotional or spiritual aspect. Okay, so remember, the holistic concept is telling that different factors are responsible for maintaining health. Okay, so it depends on many factors. It could be physical, mental, emotional or spiritual aspect. So any problem is there in any of this aspect, it can result in disease. So this is a correct theory, that is holistic concept of health. Next is, now almost everywhere I am using the term illness, disease as well as sickness. So you may be wondering what is the difference between illness, disease or sickness. So first of all, illness. Illness is actually very subjective term. Okay, only the person who is ill can tell that she is suffering or not. Okay, so remember, the term illness refers to the presence of a specific disease, and it depends on the individual's perception. Now suppose if you are having headache, it is highly subjective, only you can feel the pain here. Okay, so that time we can refer it as an illness. Next one is the term disease. Now the term disease with means uneasiness, means you are not feeling well from inside. Okay, so that is called as a disease. So disease happens when something is wrong inside your body. But remember that it does not mean that if an individual is having disease, he will always fall sick. Maybe he is having the disease inside his body, but he will not always fall sick. Okay, sometimes he may be all right also, even if he is having the disease inside him. Okay, so always he will not fall ill. So that is the difference between your disease and your illness. Okay, so illness may not be related to the disease here. Next one is sickness. Now sickness means you are assuming a sick role, or you are thinking that you are having a social dysfunction here. Mainly what happens when you are sick, you will sleep or you will take rest, and you will also expect that someone is taking care of you. Why you are assuming that? Because you are assuming that you are sick, you are not able to do any of your activities. Okay, so that is referred as sickness. So this is the difference between illness, disease as well as sickness. Next one is moving on to classification of disease. Now we are classifying disease into based on onset, based on etiology, and based on disturbance in the structure. Okay, so this is the different classification of disease. These are the three classifications. We will see each one of it in detail. So first one is based on onset. Based on onset, it is divided into acute, chronic and terminal. Now this terminology is important because again and again I will be dealing regarding acute condition, chronic condition, and also please try to remember what is acute and what is chronic. Okay. So according to the duration or onset, first we will see what is acute illness. Acute means, always remember, it is of short duration. Okay, it is present for a very short time. This is very important. Please remember this. It is present for a short time, and always remember, acute illness means the person will have very severe signs and symptoms. Okay, and then acute illness will always start suddenly or abruptly. It always starts suddenly. Okay, so that is acute illness, and it is usually intense. Okay, and after the acute illness, person can become normal in some time. Okay, so that is the meaning of acute illness. I'll repeat it again here. Acute illness means it is present for short time, it starts suddenly, its symptoms are very severe. Okay, and it will subside within a short duration of time. Next one is chronic illness. Now chronic is opposite of acute. Chronic means it is very slow in onset. It will not start suddenly. It is very slow. Okay, and it may even take sometimes longer than 6 months. Okay, so that is why chronic means it is present for a very long duration of time. Okay, and along with this, the patient will be having remission or exacerbations. Now what is remission? Remission means it is a period in which the disease will be controlled. Okay, and it will appear like signs and symptoms are not there. That is called as remission. Okay, remission means a time period where disease is controlled and symptoms are not there. Now exacerbation means suddenly, acutely it will happen. Okay, or recurrence we call, that is called as exacerbation. For example, asthma, every time the person will not have wheezing, isn't it? Suddenly only some days, or sometimes in the early morning, that is at 3 o'clock and all, they will suddenly start with the attack. That is called as an exacerbation. Okay, sudden attack is referred as exacerbation, or recurrence is also called as exacerbation. Next one is terminal illness. Now, terminal illness is usually referring to certain kind of an disease that is fatal or incurable. When the disease cannot be cured, then we call it as terminal illness. For example, your cancer. It could be any type of cancer. Okay. So what happens is, if it is not diagnosed early, in the later stages, what happens is there could be metastasis or malignancy. So what happens? The disease may spread to the entire body, and it may not be able to cure the person, the patient, the treatment may not be there to cure the person. Okay. So in that case, what happens is the person may have to go for palliative care, what we call it as pain, relieving pain and all. Okay. So that you will study in oncology in third year in detail. But remember, terminal illness means the illness which is very fatal. Okay. It is incurable. Then we call it as a terminal illness. Next one is according to etiology. Okay, classification according to etiology. Now diseases can be classified as hereditary, congenital, allergic, metabolic, deficiency, neoplasm, idiopathic, iatrogenic, degenerative and traumatic. Now, hereditary means it is mainly because of defect in your genes. When there is problem in your genes, what happens is from the parents, it can transmit to the offspring. Okay, so those diseases are called as hereditary disease. Next is congenital. Congenital means certain defects which is present from the time of birth. Okay, that is called as congenital defect. Okay, next one is allergic. If you are having any allergic reactions, or if you are allergic to any food or anything else, dust and all, that can be referred as allergic. Next one is metabolic. Now most of the time metabolic in the sense problems with the metabolism, it could be like your conditions like diabetes, and many other conditions are there like gout and all this will come under metabolic. Okay, problem in metabolism. Next is if you are deficient, there is lot of vitamin deficiencies and all those will come under deficiency. Next is neoplasm. Neoplasm means tumors. If you have got tumors or neoplasm, that also can cause disease. Next is one more cause is there for a disease, that is idiopathic. Now this term is also very, very important. Here, idiopathic means unknown. We are not knowing what is the cause. Now, sometimes what happens is you will get a disease, but you will not know what is the cause of the disease. You don't know. It has occurred by itself, unknown. Okay. So then we will call it as idiopathic. Next one is iatrogenic. Iatrogenic means physician induced. Most of the time, maybe you are admitted in the hospital, you are undergoing surgeries, or because of a person or a doctor is operating it, because of that we may get a condition. Okay, so that is referred as iatrogenic. Next one is degenerative. Degenerative means there are a lot of conditions where there is degeneration of bones and tissues, so those conditions can result in disease. Next one is trauma. Now most of the time trauma or accidents also result in diseases. Okay, it can cause a lot of defects or disabilities in the individual. Next one is according to disturbance in structure and function. Now, if there is any change in your body structure or function, that time also it may result in diseases. For example, organic. Okay, organic means there is change in your structure or organ or tissue. Maybe you have got cancer or tumor. In that case, it can cause organic problem. Next is functional, means your organ is there or body structure is there, but function has reduced. Maybe liver cirrhosis has happened, or if diabetes mellitus means your pancreas is affected. Next is occupational. Because of your occupation you are getting a disease. Okay, maybe because you are exposed to lot of chemicals or toxins in your industry, you may get a disease. Next is family. Now, family is mainly hereditary related. Okay, your defect in the genes and all can affect your family. Next one is venereal. Venereal means it refers to sexually transmitted diseases. Okay, so because of improper or not using safe sexual practices, you may get some sexually transmitted infections. Next one is epidemic. Now, epidemic, all of you are aware, it is an outbreak to one particular city or region or even to a country, that we will refer as epidemic. Okay, it is affecting large number of individual only in a particular community. That time we call it as epidemic. For example, measles outbreak, malaria outbreak, or dengue outbreak, that can be referred as epidemic. Next one is pandemic. Now pandemic means it is spread worldwide. Okay, that is called as pandemic. For example, recently we have seen COVID, isn't it? So COVID is the example of pandemic. Next one is sporadic. Now, sporadic refers to the disease in which usually it is irregularly it will occur. Okay, so sometime it is not there, but suddenly the disease will appear in some time. Okay, that is called as sporadic. For example, your tetanus, rabies, or even your plague. So this was regarding the classification of diseases. Okay, so that is we have seen the classification of disease based on the onset or based on or according to the onset, according to etiology, and according to change in the body structure. Next one, moving on to stages of illness. Now first stage is symptom experience. Okay, we'll see first what are the different stages, then I will tell you each stage. Okay, so first stage is symptom experience. Second stage is assumption of sick role. You are assuming a sick role. Next stage is medical contact. You are going to get medical contact. And the last stage is subordinate patient action. Okay. And sometimes you may need rehabilitation. Okay. This last stage may not be there for all year. Fifth stage may not be there for all. So these are the different stages of illness. So stage 1, symptom experience. Now, first of all, in symptom experience, what happens is whenever you feel sick, what happens within your body, something is wrong, you will feel that inside your body. Okay, so that is referred as physical sensation, or you may have some restriction in the body performance. So that is called as symptom experience, where you are experiencing some physical or psychological problem. Okay, so some symptoms will be there inside you that will tell that something is wrong within my body, maybe I am going to fall sick. Okay, so that intuition you may have in symptom experience. And usually in symptom experience they can have physical problem, emotional problem, or cognitive problem. For example, physically you may have headache, fever, common cold may be there, or body pain may be there, or you may feel excessively fatigued. Emotional means if you know that you're going to fall sick, how will be your emotional status? You may be worried or anxious, isn't it? Next, cognitive. Cognitive in the sense you're perceiving that maybe this disease I am having. Okay, so that is referred as symptom experience. Second one is assuming sick role. So immediately you got symptoms, what will happen? In your mind that is there, oh yes, I am sick now. So what happens when you assume a sick role? You will tend to stay in the bed. Then what happens is you will expect that your family, your friends, your social group will help you. Okay. So that is called as assumption of sick role, where you are thinking that you are sick and then you may get help from your family, your friends, or even from the society. Next one is medical aid contact. Now this one means that, so initially what happens, suppose you have got common cold or cough, what you will do, immediately you will go for home remedies. Your mother will prepare lot of decoctions and all, you will drink it. Next what happens, even within 1 or 2 days, if you are not keeping well, what you will do, immediately you will run to the hospital. You will go to the doctor and you will try to find out what has happened to you, isn't it? So that is referred as medical aid contact, that is happening in your stage 3. Next is stage 4, that is referred as subordinate patient action. So in this what happens is the person or the patient will go to the doctor and will tell the symptoms and will go and get the medicines. Okay, so here the person will need to take the advice that is given by the doctor usually. So they will assume a subordinate role, okay, and then the patient will take all the advices from the doctor and will try to improve their sickness. Okay, so that is they will try to improve their health. So that is stage 4. Next one is stage 5, that is last stage, rehabilitation. Sometimes what happens is the patient's condition may not be improving, it may keep on deteriorating, and there may be some disability. So what happens when there is disability? Most of the time the patient will have to go for rehabilitation. Now this term rehabilitation, you might have already studied it in last year in foundations. Okay, so in rehabilitation they will help the patient physically and mentally to cope up with the disease condition. For example, if the patient is having paralysis, what they will do, they will help the patient to walk. Or the patient may be having problem with speech, slurred speech, so what they will do, they will use speech therapy. So if they are not able to walk, again the doctors may advise for physiotherapy. So such things may happen in rehabilitation. Next one is what happens when you are sick. What is the impact of sickness on the patient? So first of all, what happens, most of the time you also have fallen sick. You can think what happens when you are sick. You can have emotional changes. Your behavior will be changed. Your lifestyle will change. Your concept regarding your body will change. You may also have loss of personal independence. Sometimes what happens is when you are severely ill, you will not be able to maintain your life care activities or your daily activities. You may not be able to walk well. You may feel you are tired or fatigued, and also these are the impact of sickness on the patient. Sometimes what happens is if a person is having any terminal illness, imagine if a patient is diagnosed with cancer, what will be the impact of sickness on the patient? Emotionally or psychologically, the patient may be very, very weak here. Okay, so that also can happen to the patient. Next one is, what is the impact of sickness on the family? Now, family also has to suffer along with the patient because there is change in the task. Suppose imagine if the mother has fallen sick. Now, all the work or the responsibilities of the mother, the father has to do or others have to do. Okay. So, see what will be the change of sickness on the family along with that time. Now most of the time what have they have to do, patient is admitted in the hospital, the family members have to visit the hospital, they have to take the food, one person has to stay full time in the hospital. So all this can have impact on the family also. So the family members can be very anxious, their roles will shift, isn't it? And they may have loneliness. Along with that, imagine if the family is belonging to a middle class or poor family, they have to maintain the finances, they have to pay the hospital bills. All this will have a negative impact on the family also. So this is the impact of sickness both on the individual as well as on the family.